Welcome. This is a special episode of Meet the Expert. We are live, and I have in studio Patricia Daiker. Welcome, Patricia. We enjoyed you the last time, our holistic nurse.
Thank you. I'm so happy to be here after Thanksgiving. I'm very thankful to be with you.
Yes, and we are here on live because we are capturing the very last day of National Diabetes Month. And this has been a very special month for those who are suffering with diabetes. And you have a lot of information, resources that we just had to fit this program in today. I have some questions to ask you, but before I ask you all the things, could you tell our viewers a little bit about National Diabetes Month?
Absolutely. So it was started in 1975 as a global effort. The American Diabetes Association with the World Health Organization decided to have this month. In 1982, the US officially adopted it. And it's in November because Dr. Banting, the inventor of insulin, his birthday is November 22nd. So
Oh,
it's a tip of the hat to that guy who is keeping us all going. And
yeah.
so it's a month to focus on awareness, support, and fundraising.
Well, I think it's very interesting because it's like squeezed there between you have Thanksgiving and then you have Christmas coming up. And usually during the holidays, a lot of diabetics struggle. My first work was on a diabetic unit, and I know this was really difficult time. They're with families, and it's really difficult for diabetics. So I know we're gonna really appreciate what you have to share today. Thank you
Yeah.
for coming in. Now, Patricia, you do have a newsletter. We're going to share that later, where you
Yep.
have a lot of resources. But I know you are well versed. For those who may not know you, and this is the first time they're seeing you, we know you've been a nurse for 30 years. But can you tell us why this topic is so special to you?
So yeah, so actually I've been a nurse for 40 years, but that's okay.
You
But
can't even-
all good. I'll take it. I was diagnosed with type 1 diabetes when I was 26 years old, and I was a nurse already, and I was working in the ER and started getting the symptoms and did not see it in myself. And it's not been as easy as I thought it was, or as I had instructed patients on how to live well with diabetes. And so I have learned so much about what it really takes, and I want to help people with the other side of sort of life with a chronic disease, any chronic disease, really.
Yes, and I love that you always have a holistic approach to
Mhm.
dealing with it. You never take out the mind, body, spirit approach when
Yeah.
we're talking about any sort of disease process, and that includes diabetes. Do you have any small or short framing or exercise that you can help us holistically settle into this topic as we talk about it? Because we're not like, oh, diabetics, this is for you. They always get the finger wagging, and we're coming from a deep, connected, holistic space. So, do you have anything you could share with us?
Absolutely. I do this all the time. I've done it for many, many years. And so the world will do what the world wants to do. People are going to comment on your food or ask all kinds of questions. And so we can't control that. So we control here. And the first thing we need to do is remember when we're okay. If we're not okay, go do the crazy things, take care of yourself, run around. Most of the time we're okay, right? So when we notice our shoulders going up or our jaw clenching or we want to snap at words, we stop, we pause, and we take our life back. And then we calm. We do a safety practice. So I like to put my hand on my head, deep breath. I'm okay. I'm okay. Even though that person may have said something, even though maybe I made a food choice I'll regret later, even though I'm okay, I'm making a choice, I'm taking my control back, and I'm going to stay centered, right? And that it brings the power back to you versus reacting to all the things the world will throw at you.
Mhm.
I'm
That's
okay.
wonderful. I'm okay, despite all of the things,
Mhm.
maybe fell off my diet, but I'm
You
okay.
know what? Nobody's perfect, right? And even in my coaching, the mantra is I can win at persistence every day. I can't win at perfection. So my goal is persistently, I show up and I do it the best. And every day the best can be different. but I
Yeah.
do my best. I pay attention, and some days are better than others.
Days are better than others. I love it.
Yeah,
Persistence, not perfection. I
yeah,
love it. And I think it's a really beautiful energy to slide into our
yeah,
topic today. So some questions I had prepared for you. I just wanted to talk a little bit about diabetes. You know, as nurses, we treat it as a physical disease, but in the holistic world, we know that it's way more interconnected than just physical. So
yeah.
can you share with us how the mind, the emotions, our spirit play a part in managing or even transforming this chronic illness?
Absolutely. And so I'm going to give you a story. I love stories. So I want you to experience it and know what it is, and it creates a new kind of understanding. So imagine COVID. We all got stuck in a place we didn't want to be. We didn't
Mhm,
ask for it. We had no control about it. We were very limited, right? And it wasn't fun. Nobody liked it. Nobody wanted to be there, except for we don't get out. There is no end, right? That is the emotional toil that we live with every
mhm,
day, that we could have a really potentially bad outcome, right? And
mhm,
so nobody asked for it, nobody wants it. It's so much extra work, and it is isolating. So if you just imagine what that felt like, and then there's no hope of it ever being done. And so that's the part that is the emotional burden. And we have to find a place to be safe in an unsafe body, right? And that is in a mental and emotional awareness. We need extra support. We need to process all that stuff. And we need to be allowed to not be perfect, right? Because everybody wants perfect, perfect numbers, perfect eating, perfect la, 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 right? All the things.
yes,
So even as nurses, that's what I thought back in the day. If they just ate the food and did the drugs and did what the care plan was, they would be fine. And if they're not fine, it's on them. And I'm just here to tell you it is so much more. And it's more of an inward journey, because until you find peace within yourself, it's hard to have the emotional and the mental fortitude to make really good long-term decisions. Right.
wow. Thank you for that insight.
What
Now, now, Patricia, you coming from where you are, from being a nurse, also having the symptoms of the disease, there's a lot of chatter right now about these GLP-1 medications
Yep.
and for weight loss, for control. Many people may be wondering, especially from a holistic perspective, what are some of the pros and cons of taking these medications? Do they really work? What's the long-term consequences of being on these?
Yep. So let's talk about what they are. GLP-1, it's a glucagon-like peptide. So it's
Okay.
something that's produced in your gut after you eat. And so what happens is it increases your insulin production and sensitivity. It decreases the glucagon production, which is what dumps glucose back into your bloodstream. Um, and it helps you feel full, right? So all these are triggers in a normal working person to stop eating, right? To start digesting. When the reason that's advantageous for someone with diabetes is A, feeling full makes you stop eating, so you don't eat as much. It
Mhm,
delays gastric emptying. So the food that you do eat isn't hitting your small intestine so fast where it spikes your blood sugar. If you produce insulin, which I don't, but a lot of people do, it makes your insulin more sensitive, so you don't need as much. And insulin is a fat storage hormone, so less insulin is less fat. And then just it's not dumping that glucose back into your bloodstream. So the glucagon that's your liver um, dumps glucose back into your bloodstream in that process. So it helps to reduce blood sugar levels. So lower intake, delay gastric absorption, bring down blood sugar levels. It just makes it a lot easier. So in theory, that's a really, really good thing.
mhm,
Um, I think the biggest problem that I've seen with it is it's not just a shot and you're done. So I've actually am working with some companies that do a really good job of this holistic, where it's counseling, it's therapy, it's nutrition, it's support for how do you take this thing and do all the other lifestyle changes, because it's not just a medicine. So
yeah,
that's probably the biggest problem, is it's treated like, hey, I can take a shot and do what I want.
yes.
um, when the shot goes away, you go back to your body functioning how it did. So now we're seeing people that lost weight. Now you get the yo-yo. And this
Mm,
is sort of a lifelong approach unless you really change your lifestyle.
okay.
Um, and the compliance rate with these GLP-1s are very low. Typically, just medication alone, people don't tend to do them for a long, long time.
Mhm. Okay, okay.
That's
So it's like anything else, you have to do a lifestyle change. You have to do a
Mhm.
mindset shift. Um,
Right.
not it's not just the magic pill that's just gonna make you lose weight and feel better.
Right. And I
Mhm,
think the other scary part that you have to be mindful of is you're not going to eat as much. So when you do eat, right, it can't be junk food. You need nutritionally dense food or you're not going to get nutrition. Now, everything else aside, our bodies still need nourishment. So
mhm,
if we're going to eat this much and we're going to come down and eat a lot less, you have to be super mindful that you're getting in all the groceries that your body needs to take you where you want to go, right? So
mhm.
it's just it again, it's just not a simple pill. I think there's just a lot more to it, and you have to be mindful about what you're stepping into, right? So, but it certainly can help you lose the weight, which can make it easier to work out and can help bring blood sugar levels down. There's all those really good things that you hear about,
Mhm.
and it's just you gotta know what you're signing up for and have the right support.
I love it. Such a balanced approach. Now, many people who are
Mm,
living with chronic diseases such as diabetes, they are stuck in cycles where they are stressed. They have cycles of stress and emotional fatigue. How does your nervous system regulation serve as a bridge between medical treatment and
right.
holistic healing?
Yeah, so this is my favorite place to go because this to me is step 1. So I guess step 2. Step 1, you notice you're kind of in that state, right? You're frustrated, you're overwhelmed, you're done, you went off the roller coaster, you just fatigued because you can't do it anymore. That's where we have to notice, and then we do something different. All of those symptoms are either chronic sympathetic nervous system stimulation or even shutdown. We can go to the part where our nervous system's like it's a dorsal aspect of your vagus nerve that we just go and we're done. And
Mhm,
so those aspects, fight or flight is short term, reactive, defensive, myopic,
mhm,
negative, very outwardly focused, and it's
mhm,
hugely depleting of your energy just to be, we know when our shoulders are up, our jaw's out, we're mad at the world, this is not fair, right? We are in a place of survival that is not safe, no matter what the disease state or can be mental, physical, anything, right? We're not safe, we're not okay. Your parasympathetic nervous system is safety. And so when we can learn to notice that we're doing this and clenching our jaw and right, oh, okay, there I am, and that's where we go. I'm okay. So instead of telling our brain all those thoughts broadcasting to every cell in our body saying this is bad, we're not okay, we come back and remind ourselves right now, I have lights, I have electricity, I'm clothed, I have
mhm,
people, whatever that looks like, I'm okay. And so all of a sudden your nervous system's like, oh, that's not a danger signal. So we kind of soften. And then we can do breathing techniques, right? And so those baroreceptors we stretch in our thoracic cavity, the inhales that are long, the breathing, things like that. Your body doesn't do that when you're in fight or flight or when you're running from the predator.
yeah,
So those signals also begin to shift your nervous system. And the more we start doing these things where, oh, the body's relaxed, I'm
right.
open in my chest, it brings you into this parasympathetic state. Why is that a good thing? You're thoughtful. You can be curious. You can be open. You can receive input. You're not defensive and thinking someone's out to get you. It minimizes the negativity bias where you're like, well, okay, I can take in information without feeling like I'm being judged, right? It
Mhm,
softens everything from like an emotional
mhm,
standpoint. You get less brusque,
yeah.
and inside you become a different chemical human being. Less cortisol, less epinephrine, more of the happy drugs. We're synthesizing different proteins, up and down regulating different sort of epigenetic triggers. Your whole physical you, this physical body, is a different chemical soup than when you are triggered, right? And
Yes.
the last thing I'll say is that is when healing happens. Healing happens when your body has enough energy and resources to turn inward. So I love this saying, and I with my clients a lot. But healing doesn't happen when the house is on fire. You're just in the bucket brigade, and we're doing what we can to protect the structure. Healing happens in the maintenance mode when we're cleaning out the cobwebs and we're getting rid of the inflammation and we're digesting fully and we have extra proteins to go repair tissue. So that parasympathetic state, A, it feels better.
That,
B, you're much more open and connected and you can learn and you can think and you can plan long term. And then,
mhm.
the last one is our bodies are different. It's much easier to heal. And no
Yeah.
matter what you're dealing with, no matter what illness or situation, it's parasympathetic is a much easier way to go. We just have to learn how to it's a we have to learn how to get there.
Yes, yes. And I love being a holistic nurse talking about the nervous system because this is something that's not really stressed. We use stress, take your medications, right? You're not thinking, oh, you're diabetic. What is your mental state? Are you in fight or flight? Or can we calm you down? Can we bring you back to baseline? So this is very, very powerful. And I love how you mentioned that actually the even though we're not giving them any medication, we may walk through a breathing exercise. The chemicals on the inside, and we have to stress that the chemicals on the inside, your body is giving you different sort of different medication in
Yeah,
essence.
absolutely. Yeah. You're reallocating your resources, right? So instead of the resources, the energy, the nutrition, the building blocks that are inside of you, instead of those being biased towards defending the territory, they can
Mhm.
turn inward, right? And be used for healing and repair and nourishing the physical vessel that we are.
That's beautiful. Thank you for breaking it down, and thank you for educating us on some of the
Mm,
scientific things behind the exercise of just breathing and shifting our nervous state.
yeah.
I did have another question here for you, and it has to do with because when we talk about mind, body, soul, there's also an emotional and spiritual component to chronic disease. So,
Mhm.
can you share with us what are some of the signs that you have seen where emotional suppression or spiritual disconnection is actually impacting health outcomes, where the person's illness can actually be a sign or a message from the body that they need to slow down, or
Yeah.
they're actually misaligned and they need to realign.
Yep. So, boy, this is a whole nother topic, but I'll try to boil it down into something. So, if we look at body, mind, spirit, my little mantra of that is well-being feels like peace in the mind, flow in the body, and connection of spirit. And I'll say spirit as in the part of you that is in relationship with higher power, nature, people, others, and self. And so, all three of those parts of you need care. When one part's not getting care, it may feel like chaos in the mind, stagnation or disruption of flow in the body, or isolation, disconnection, feeling unheard. So any one of those three can kind of be out of balance, and it's what we call dis-ease, right?
Mhm.
Chaos, worry in the mind, or just blood sugar. If you think of flow, glucose being out of regulation is it's not flowing where it should flow. All body systems should be in flow. But typically what happens is we run out of energy, so we get really fatigued. We feel like we're misunderstood, we're not connected, and we feel uh, like no one understands us, right? So we get this worry in our mind too, like something's not okay with me. All those little three pieces get out of balance. And so often in healthcare, we try to just fix the body part,
Mhm.
but sometimes having a little bit more peace in our mind and slowing down or feeling connected. That's why the nursing touch,
Yes.
right? That's why
Yeah.
that feels so good is we actually connect human to human. And I could go on and on and on. I'll stop right there and see if you want me to give some other definition.
Oh, I love this. I love this. I think we don't talk about this enough. And this is the part of holistic
Mhm.
healing that as nurses, we have so much latitude to give education. Uh,
Yeah.
you know, those who are suffering from chronic disease, a lot of times, and I say chronic disease, such as diabetes, such as, there are so many different chronic diseases, but when you are dealing with a holistic perspective of healing and health, what you're saying, Patricia, applies to so many diseases, not just diabetes.
Oh, absolutely. The other thing is another simple tool that I use is about typically when people don't feel well, their needs are not being met. And so part of a holistic journey is what's your need? Is it the need to connect, the need to be seen, the need to be heard, the need to not be in pain? Like there's a need in there. And often in our allopathic healthcare world, we look at the broken body part or the thing that's out of range or whatever that looks like. And that may be a need that needs to be addressed. And that's my other big capital A and what are the other needs of that human, right? Because sometimes if those needs aren't addressed first, they can't change their diet. They can't figure out the medicine. They can't get to the treatment part because we haven't started with the things they need so they can actually process and understand.
Wow, this is powerful. This is powerful. What are some ways you think, as providers or as caregivers, we
Mhm.
can help to really make those needs surface or bring them up where we can actually identify what the needs are?
I think asking first, like, and again, I'm always kind of a patient advocate trying to get people to sort of step up for themselves. So my message with them is before you go talk to someone, know what you need. But I think that could be a great, hey, I've got 20 minutes to talk with you today about XYZ disease. Like, what's going on in your world and what do you need today? What would be the most helpful? And my lovely doctor does that. He is the best. He's like, what do you need today? And I
Yeah,
tell him, I'm like, I need a prescription or I need help with navigating insurance or I don't understand this CGM pattern, right?
yeah,
But he asks me. And so then I get the floor, right, to say,
yeah,
this is what I need. And often until I figured that out, I just answered all the questions hoping they would touch on the thing that was important to me,
yeah.
right? Because we
Yeah.
have a list of questions as providers that we have to keep up,
Yes,
right?
Trisha, and I don't mean to cut you off, but you
No,
are
that's
super
okay.
self-aware. So if I ask you what you need, it's like top of mind. But a lot of people, especially those who are dealing with chronic disease and a broken healthcare system and all the things, well, you ask them what they need, and they're like, take a number. I have so
Right,
many
right.
that a half of them don't even think that you have the answer to their needs.
Yeah.
So, but from a holistic standpoint, I feel like sometimes, like just how I asked you to start off with a practice,
Mhm.
sometimes doing a practice, so sharing with them some breathing techniques, so just giving
Yeah,
them
yeah.
clarity, they could actually start thinking about, well, what do I need?
Right,
They,
right.
nobody ever asks them, and they don't even think like that.
I think what as a practitioner, the best thing you can do is sit down so you're facing to them. How often is it this power balance? Here's the doctor, they're standing over you, you're at a chair, they're standing over you, right? It's just physically intimidating, especially if I'm very comfortable in the healthcare setting, so I don't have that. But
Mhm,
sitting down, right?
mhm,
Sitting down eye to eye, human to human.
yes,
And I think another great word is what are you been worried about? People know what they worry about.
that's true. What are you even worried about? Yeah,
They
yeah,
will know, right? And then it gives you a nugget to grab onto, right? They may not know what they need, but they know what they're worried about. We
yes.
we are great warriors.
Yeah, and I wanted to plug in something there too, because sometimes, as nurses, we get such a mode and we're just like working, and it's a part of the questions that you ask, what's important to you today, and you just keep going and you're not even present. So I would say even the presence, being there, because you can ask somebody something, and you can ask them knowing that you have to just check something off or write something down, and you can ask them knowing that you really care and you're really attentive to what they're going through in
Yeah.
terms of experience.
I would back up one for the nurse. Let's say, I'm going to focus on nursing because it's easy for us to talk about. Before you go in that patient's room and your hair's on fire and you got to be everywhere,
Mhm.
give yourself 5 seconds. I'm okay. I'm coming back to now. I'm going to talk to them about blah. Just that
Yes,
little bit of shift. And when you walk in that room, little, little, recharge your battery so
mhm.
that you're not reacting, but you have created a little space and then
Yes,
the encounter will feel different. because I'm guilty. I remember, back in the day,
Yeah,
you got your clipboard and you're running in and you're doing the things, but do you have 2 seconds just to go
yes,
and bring your energy down because
yes.
it changes the difference just a little.
Yes. Usually we're like, we have no time, I work in leadership. So it's like we're so busy, we have no time. But then you have to give yourself time. You have to create the time. And using the breath can actually create that space.
Absolutely. And I will just say, when people tell me that, this is my old ER nurse. But you know what? If a drug rep brought donuts to the break room, we all had time.
It's true. It's very true. It's very true. It feels awkward, but it's so powerful. Just using
Yeah,
the breath and bringing intention and mindfulness into
yeah,
the space. Beautiful. Now,
yeah,
Patricia, you wrote a lovely book and it's coming out. You want
yeah.
to tell us a little bit about your book?
I'll give you a hint. So it's in the editing stages right now, so it'll be released next year.
Okay.
It is a partial memoir and a lot of my coaching tools. So the title is called Diabetes is a Narcissist. And it's a framework for understanding how to live a life with this inner roommate that will never play by the rules fair.
Okay.
And it will take and take and take and take, and we give and give and give and give. And we're encouraged to by the medical world
Mhm.
to be this perfect person. And when you look at dealing with narcissistic personality types, it's about creating boundaries and taking care of yourself first and knowing where your limits are. And so it's a lot of life of how I learn these things. And then at the back is an interactive section of different tools that you can use that make sense. It's like very practical of, and really it's through the lens of diabetes, but it's just my story. Um, it's appropriate for anybody. Just like we said today, these tools are not unique to people with diabetes.
Love it. Love it. Anyone can use it. Patricia, you have been doing such beautiful work in the community, in your community, in the diabetic community. I'm just so proud to know you and to have
Oh,
met
thank you.
I know we dedicate 1 month to talk and to focus on diabetes, but
Mhm.
of course, every day of the year, people live with the disease.
Yep.
So how can we support you? The viewers looking in, your fellow nurses, we're
Yeah.
seeing you do so much work. How can we support this work that you're doing?
Yeah. So now that we talked about it before, but one easy way is if you want to connect and get information about my book, you could subscribe to my newsletter and we can put a link there. If you want to support me in raising funds for Breakthrough T1D, which is a national diabetes organization. It used to be called JDRF. They've rebranded. I'm fundraising. I did a walk for them. That's open, and that would be great. And then I think thirdly, oh, I forgot the third one. It went away. I had a third one. What was I going to say? Oh, I know, I know. I want to do more of these speaking engagements. And so I would love to have opportunities to speak to people,
Yes.
different groups about just really this holistic approach, how to live your life better with chronic disease, how to find more peace in your life when there's chaos outside, how to feel safe in an unsafe body, those kind of things. Um, I think that would be a true gift. So if anybody is looking for, people to talk with their groups or engage, I would love to do that.
Wonderful. And of course, by seeing you, we already know you're such a beautiful speaker and you are also an educator, which a lot of times, we tell people the what's, we don't tell them the whys. We don't get the opportunity at the bedside to break down all the intricacies. So to have someone in the community such as yourself is such a treat. And I'm sure you can do virtual too,
Yeah,
as well
absolutely.
as in person.
Yeah,
Mhm.
yeah. It was funny. I did some work one time and they were like, you're trying to identify your archetypes, And so leader came up. I've always been charge nurse. I'm always raising my hand. I'm happy to do that. And
Yeah.
I've loved being a teacher. And early on, I had this term of healer, and I'm like, I don't know if I'm a healer. I don't know if I heal anybody. And recently, I came up with this term of way shower. And that's what I want to be. I want to be a way shower. I want to show people a way in their own lives to find some bit of better, whatever better looks like. I
Nice.
can't do it for you. I can't make anything, but I want to show you from my training, my teaching, my nursing career, my corporate world, my own experience. I want to show you what might be a better way than where you currently are. And that gives me a lot of joy.
And I would name the show "Meet the Way Showers," but then people might say that sounds kind of a little weird. But when
Yeah,
I thought about the word expert, I think about, they say experts say, but who are those experts? We don't know them. So I thought the experts of the future will be the way showers, will be the people who have lived and experienced and have success, and they are looking back to leave a legacy. So
yeah.
you definitely who we love to have on the show. I hope
Mhm.
you will come again. And then if anybody's listening, they're reaching out, they're like, wow, we need her to speak in our community. Please be sure to leave comments below,
Yeah,
connect with her on LinkedIn, or connect with me and I'll connect you with her. We are bringing just so much light and beautiful positivity out into the world. Uh, this is just beautiful. It's just beautiful to have this connection. So if you have any comments, if you have any questions for Patricia, please leave it down. Below, you'll see all the links. I'll put it as a comment, not in the description because we're live, but I'll put it as a comment.
okay.
So you can always follow up with your newsletter, your book, and
Yeah.
all the beautiful things you have.
Well, thank
Thank you,
you.
Patricia, so much for being here. Thank you, viewers, for listening on this impromptu special episode. And we will see you next time.
Thanks. Thanks, Casey.
Thank you, Dave.
Everyone.
Have a good